Hi, I'm Dr. James Meschino. What is erectile dysfunction? Well, it's defined as a consistent inability to obtain or maintain an erection for satisfactory sexual relations. And then there's complete erectile dysfunction or complete impotence, which is an inability to have penetrative relations at any stage. And so this is where you're getting sort of a complete inability to perform, if you will. How common is the problem? Well, about 50% of men by the age of 50 have some degree of erectile dysfunction. By age 60, about 75% of men complain about this problem. So why is this happening? Well, the aging process is part of it. After the age of 40, your blood testosterone levels, if you're a man, drops by 1% every year. So between age 40 and 70, you have a 30% lower circulating testosterone level. So that has an impact for sure. And then if you're clogging your arteries because your diet is bad and you have high cholesterol or triglycerides and you're clogging your arteries up, atherosclerosis can decrease blood flow to the genitalia, and that's going to increase the likelihood you'll have problems. So keeping your blood cholesterol really low makes sense. Under 150 milligrams per deciliter is ideal, or below 3.9 millimoles per liter if you're using the other units. Diabetics have a greater risk for erectile dysfunction because diabetics have a greater propensity for plaque to clog up their blood vessels, and that includes the blood vessels that lead to the genitalia. So for diabetics and pre-diabetics, you've got to get your cholesterol down, manage your blood sugar properly in order to maintain blood flow throughout all of your body, prevent heart attack, stroke, and gangrene problems, but also maintaining normal, sexual performance ability. Alcohol also increases the likelihood of erectile dysfunction if you drink alcohol regularly. And psychosocial factors, of course, relationship problems, lack of attraction to your mate, and just, the stress of life sometimes can beat us down where, your sexual desire, your libido starts to fall off, as well as your performance. And enlarged prostate problems can also cause problems with erectile dysfunction. And in the aging process, the nerve receptors in the glands of the penis, they start dying off, so you have a fewer number of nerve receptors there that can transmit sensation back to the central nervous system. So it becomes more difficult to get that arousal response even with physical stimulation. And there are many drugs that can actually increase risk of erectile dysfunction, which I review on another video that's available. What are the medical treatments for erectile dysfunction? Well, drugs like Viagra, Cialis, Levitra, you know about them. What do? Well, they tend to stop the breakdown of a chemical in the blood vessel wall. And when you stop the breakdown of that chemical called cyclic GMP, when you stop the breakdown, that tends to cause the blood vessels to dilate and stay sustained so you can improve blood flow to the genitalia. The problem is that they tend to do it inadvertently in other blood vessels throughout the body. And so when you dilate all the blood vessels at once, the blood pressure drops down and the heart starts to respond. It can start to flutter, go into fibrillation, and you can have cardiovascular adverse events. So in the Cedars-Sinai Hospital study, we saw when they reviewed 1,400 adverse events related to the use of Viagra, we saw all kinds of cardiovascular complications from the use of Viagra, including sudden death. So if you want to review that for yourself, it was published in the American College of Cardiology, the Journal of the American College of Cardiology in the year 2000, in one of their supplement editions. So I have some concerns about those drugs. I also have concerns about doctors prescribing testosterone for erectile dysfunction, because if you have any prostate cancer cells already in your prostate gland, and many men do by the age of 50, and you start taking testosterone, it's like putting fertilizer on those cells, and they can start growing and developing, and there's a greater risk that prostate cancer that's significant might actually affect you. So what's underappreciated, I will tell you, are the natural remedies that have been shown in clinical studies to reverse erectile dysfunction and improve sexual performance in men and also in women. So I want to touch on those natural remedies right now. The first one that I really like is called Tribulus terrestris, also known as puncture vine. Studies show that it increases the release of nitric oxide in the genitalia, a greater amount of blood flow, and has been shown to give a firmer erection, longer lasting erection, and reverse erectile dysfunction issues via that mechanism. And then there's an herb, that comes from Brazil called Muira puama, which has been shown over the years to be an aphrodisiac and nerve stimulant. It's listed in the British Pharmacopoeia as a treatment for impotence, so it's got, medical recognition there. And then studies at the Institute of Sexology have shown, in France, have shown that Muira puama in different combinations has been shown to be useful to improve libido, frequency of intercourse, and also to correct erectile dysfunction problems. There's another herb called Avena sativa. Also, it's a wild oat. You've heard the expression sowing your wild oats. This is where it comes from. In the Avena sativa oat, there are substances that increase tactile sensation of the genitalia, increasing sort of pleasurable sensations. So when tested on men in clinical studies, 22% of them reported improved sensation coming from the genitalia, so an easier erection. And even in women, 15% reported improved genital sensation and a 29% increase in frequency of orgasm. And then, of course, maca root, which has been used traditionally as an aphrodisiac. And the herb known as epimedium, or horny goatweed, has been shown through a number of mechanisms to increase sexual potency, if you will. We think through raising dopamine levels. The higher your brain dopamine levels and the nervous system's dopamine levels, there tends to be a greater amount of sexual activity, and sexual performance abilities tends to be increased. And then Damiana root, which has been shown to increase the sensitivity of the genitalia as well. So when you put all of these herbs together in a combination formula, what you're getting now is increased blood flow to the genitalia, so you get a better erection, increased sensitivity of the genitalia, and even increased libido and sexual desire. And again, these herbs have also helped not just men, but also women. Women who have low libido, have trouble reaching orgasm, less sensitivity around their genitalia. It has the same effect on women, reverses those issues, allows them to have greater sensation, easier climax, and a greater sexual desire than they had in the past. So there are some clinical studies that are just mind-blowing on this. So that combination is really great. There are some dangerous supplements that people use, supplements that work for erectile dysfunction, but they have potential side effects like bleeding disorders and toxicity that I want you to stay away from. So I've explained exactly how all this works and exactly dosages and how to do this in the most practical way in a little ebook that's available right here. It's called Effective Natural Remedies for Sexual Performance and Libido, a Guide for Men and Women. So you really should download it right now if you're interested in this subject. Remember that at meschinohealth.com you'll see my other research review papers, you'll see other videos that I've created. You'll see footage from my live professional seminars, other resources and downloads that I put together. They're all there for free to help you lead a long, healthy, functional life. Not just being alive with a heartbeat, but being functional as the years go by. All the research papers that I have and teaching materials have all the scientific references in them, so you know you're getting only sound scientific, evidence-based information from me on any health topic that you're looking for. So you really should make meschinohealth.com an ongoing, reliable health and wellness resource for both you and your family members. Thanks so much for watching.